So now you've waited 2 very long days, and it's finally time to take off this wrap. Are you ready to see what's underneath here? You don't need scissors, you just need your 2 hands and find the piece here to start unraveling, okay? If you have trouble, you can get a friend or a family member to help you take off this wrap and just kind of go layer by layer. You're gonna find first this tight Coban dressing, trash. Next layer is gauze. Take this off, just all of it just unravels, okay? And then is this big piece here, it's just all gauze. You'll find Vaseline on your face. You may see some dried blood, some bumps, swelling. That's all very normal. You have 2 yellow Vaseline gauzes here. You can just pull those off gently. If they're a little stuck, you might need to use some saline, or you can use a little bit of the peroxide to kind of help loosen that up. Okay, and then this all just goes right in the trash. Here on this ear, just gently all the way around and into the trash, okay? So now we're ready to clean our incisions. So we have our Cetaphil facial cleanser, okay? You're just gonna wanna gently, with clean hands always, because you don't wanna get anything or an infection into the incision sites. Just use, warm water. Just dab the skin lightly, kind of get all that dried blood off your face that's around behind your ears. Use a little bit of the Cetaphil facial cleanser. And just, wash your face gently. Don't rub, just kind of pat. You can rub on your cheeks a little bit. You may be very sore, but just kind of clean along here, okay? Then with the water, you're just gonna clean your face again, wash off all that soap, and then with a towel, just lightly dab dry in those areas, okay? You don't wanna be rubbing your face too hard, anything like that, okay? Then you have your hydrogen peroxide and your Q-tips here. And you're just gonna go right along the incision sites here on your ear and kind of just clean, dabbing gently all the way along. And then behind your ear, I don't know how to really show that. Behind your ear, clean there as well. Just get a good amount of peroxide onto the incision site and clean. But every time you do a new area, get a new Q-tip, okay? This is not the Super Bowl, no double dipping. Okay? All right, and then after that, it's time to put on the Vaseline, okay? So you can also use a Q-tip for this. Just apply just a thin layer here on the incision sites of Vaseline, okay? And now you can take a shower. We're putting on the Vaseline because it's water impermeable and it's gonna prevent any water or soap or anything from getting into those incision sites, okay? When you get out of the shower, you need to reapply the Vaseline back onto those incision sites to keep them moist. That's a wrap, and that's all you need to know about taking off that wrap and moving on to cleaning those incisions.